learn from other mistakes. And definitely after this 10-day sessions, you will be getting a supervised practice as well. So I'm going to share my screen to tell the consultation structure of Dr. Gul, how she started. So we'll just double check what she has done and what she could have improved on. So if I tell you this structure, if you see that structure, you will find out start with the smile. Start with the smile, okay? And when if you are in the setting, like when you go into the room, your energy should go into the room, and your energy should go into the room as well, okay? So this is how you would start with sitting with the appropriate posture. So she was very polite, and she was like started with the very calm tone. She asked why happened. ID check was done. Full name. She introduced by her name. Name of preference of the patient could be asked as well. So you can ask that question as well. Name preference of the patient you would ask. And after that, empathy. Yes, she was very empathetic. She was doing active listening, and she was reflecting back on, and she was head nodding. Yes, I could see that she was head nodding, and this is the way she was involved in the consultation. And she was appreciating, acknowledging the pain as well, and remembering the setting is important, that where you are, in which setting you are, identify the type of consultation, identify the presenting complaint. She did ask open-ended questions. She followed the Socrates part, and close-ended questions. She given options like different. Head nodding again. She was signposting. I don't know. Like period history wise. Before that, she able to know that she's having this, but when in the real exam setting, they might be calibrated in a way that you will ask about the period history. Then she might say, asking red flags. So there bit of few improvement was needed about ruling out the red flags. I'll come to that. Simple question. So the history part, DD's part was not very, it's not, it should be little bit more questions. I'll show you in a while. So
Yes.
so the systemic review could have been related as well, but again, it's a long consultation. Again, woman or male health question was period question should have been. Sexual history, I don't know. I was wondering why you did ask sexual history. That was extra thing here.
To ask about the contraception,
You can
basically
ask
to
in
ask
the
about
Meftosa drug portion only. You don't need to go to the.
okay.
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 By any chance you're using any drugs like contraceptions or something? Sexual history was 100% not related here, because you're not ruling
Okay.
out infection or anything. So you did ask. You shouldn't
Okay.
ask sexual
Okay.
history. General health history,
Okay.
Meftosa, famation, everything. So Meftosa was done well. Social life history. You did ask about alcohol or not?
Yes,
Yeah.
I did.
So DASA diet was not important, but social condition, house was like you need to rule out those things. And coming to the ICE, you done the ICE ID expectation concern, psychosocial. You would say like it has been going for long. It must be affecting your life. How it's affecting you? Examination, simple words. So at this point, I would like to examine you. I would like to have a quick feel of your head or something like that, and you would can say that I would like to see the front and back of your eye because she got bloody vein. So there would be no finding for that from the examiner, because they are going to correlate with the blurry vein or watery vein with that. Basic investigations was not needed, just general finding, explain finding. There might not be any finding. Explaining, diagnosing in simple words, that what it is and how it is related. Management urgency order. So she should have given a different pain relief if she already tried that. And admission not required. Referral was important. Follow up with the GP was important. Follow up GP, not referral. Follow up with the GP was, if it's, and you tell them that is, the reassurance was very important, that I want to reassure you this, but as it's not getting better from the pain, I would like to change the pain relief. And shared plan, it could have been more shared because you left out of time, because a few of the things, history should be more focused. So that was done well. So I'm going to share the headache sketch again, and then we'll start doing another one. Okay. So I'm going to share the headache sketch one more time.
Well, just you move on with Dr. Zeeshan, that I should have asked about the signs and symptoms because, as Dr. Zishan told me about the brain cancer, that the patient is suspecting a brain cancer, my history should include about any numbness, any weakness in the body part, or any diplopia or double vision,
Yes,
right?
yes.
Yeah. So I thought that we are doing the menstrual migraine, and I don't need to ask anything. But in exam, you need to cover every differential. You need to ask
Uh,
everything. Otherwise, you won't get the diagnosis. All right?
So I want to add few things here. Good.
Yeah.
Basically, when you will do different notes, students, so that you outside the cubicle will get to know the diagnosis, and you will become very robotic. This is how we become robotic. They want, they want us to rule out everything. So this is what you even you know it's a migraine, you still to be on the safe side to ask all those questions. Again, you start with the Socrates. You'll ask how long it's been going on. You're just thinking about the worst thing. You will be thinking about the worst thing. You will be thinking about the worst thing. Okay. So, as a doctor, if you're thinking about the worst thing, you are a safe doctor. Okay. You'll start with the worst thing, then you will start saying that's quite reassuring. And then you will go fewer ask these questions. So these are the things you can rule out few of the things, and you could ask about problem like any weakness, any part of the body. You try to rule out that one, and these are the question you can ask about stress would be ruled out, and the blurry vision was already, and another few questions you can ask from all of these. By any chance you hurt your head, trauma to your head, all those questions you can add on. When coming to the last, alcohol is most important here, stress is most important here, and these are the things we would do, and these are the things. So let's do another common scenario which can come in exam as well. We can get even less Aruba, oh sorry, Gul, give me any scenario from headache. What I would do rather than knowing anything. So I'll try to do all the history, and I shouldn't be knowing what you are going to give me. I just want to rule out anything I don't know. Okay. So I'll try to rule
Oh,
out anything. I'll try to take history and I'll try to proceed what it is. So out of those 11, 12 scenarios, give me any. I give you 1 minute what you're going to give me. I don't know what you are going to give me. So I will
I'm
try.
ready.
I'll try to be as natural as possible, and if it's like let's see how I diagnose it or not, okay, and how I go it. So it will be more realistic because I don't know the scenario, okay, and I'll put on the 8 minute timer. I'll try to rule out the things. All right,
You are FR2 in general medicine,
okay.
and David, age 25, came to the hospital with headache. Take a focused history, assess the patient, do examination, and